Dear viewers, welcome you all to our show OSA, that is Orthopedic Solution Academy. Hope you all are well during this COVID-19 pandemic situation by wearing masks and keeping distance with each other. Before starting our program, I would like to say that this is the month of February, the month of proud and the month of mourn for all Bangladeshi people. As because of on 21st February in 1952, many martyrs of Bangladesh sacrificed their life for the mother tongue movement. And only for that, the UNESCO declared the 21st February the International Mother Language Day. So it's a great honor for us. আমরা আমাদের বাংলা ভাষাকে ভালোবাসি, আমরা আমাদের বাংলাদেশকে ভালোবাসি. Dear viewers, our topic is osteosynthesis, not according to Ilizarov. Why did it happen? A very interesting topic. And our speaker is the highly academician Professor Novikov sir from Kurgan, Russia. I would like to request Professor Novikov sir to join with us.
Good afternoon, dear colleagues.
Good afternoon, sir. Dear
Be
viewers, we
healthy.
have, yes, sir. We have three learned academic experts with us. One of them is the legendary Ilizarov surgeon from Bangladesh, Professor Mofakkarul Bari, sir. I would like to request Professor Mofakkarul Bari, sir, to join with us. Sir, welcome. Welcome to our show, sir, Orthopedic Solution Academy. Thank you very much for joining with us. Dear viewers, we have another enthusiastic Ilizarov surgeon from Patna, India, that is Dr. Shamsul Huda, sir. I would like to request Dr. Shamsul Huda, sir, to join with us.
Thank you, Dr. Tanvir, and good afternoon from India.
Thank you very much. And we have another academic expert from Kurdistan, Iraq, that is Omar Barabi, sir. I would like to request Dr. Omar Barabi, sir, to join with us.
Thank you so much. Good afternoon, everyone. Thank you so much for all of you.
Thank you very much, sir. Dear viewers, now I would like to request our honorable speaker to start his presentation, and the topic is osteosynthesis, not according to Ilizarov. Why did it happen? Professor Novikov, sir, would you please start your presentation, sir?
Thank you very much, dear chairman. And let me a few seconds explain about time. 10 days ago, I go from Kurgan through the Moscow and have planned leave from Russia and go to the conference to Iran. But inside of airport, I have positive analysis of PCR. And just now I have SARS, COVID, and haven't any contact with all of life, stayed alone at this good house. My friend give me chance, stayed here. And this presentation I find from my mobile, because just now we have possibilities during our job, make some photos and keep in the memory. And Ilizarov Center is unique clinic in the world. So many patients with different problems come from everywhere. And you know, Michelangelo and Ilizarov, Michelangelo from orthopedics, give us chance change the life of difficult cases with patients. This photo I find in my memory in mobile when we was in Bangladesh a few years ago, and I really was very expressed and I was happy, shoulder to shoulder stayed with doctor from excellent, beautiful country. Near with me, my teacher, my father, Professor Shevtsov, in other shoulder, my friend and my teacher, Professor Bari. We not only contact with and show our present, we go to the operation theater. Our team show our experience, and We need collaborate. We need change our experience. This is Dr. Klushin. This is the center of Barry Ilizarov, very famous in the world. And I want to show on this presentation very strange cases. First case, young girl, when she come in our department, she has more than 20 surgeries with diagnosis. She admit with condition after surgical treatment by Ilizarov. Condition after synthesis by Ilizarov of the right femur. Shortening of the right tibia, combined contracture of the knee joint, and only last point, tibia hemimelia. From anamnesis morbi, we find some information, more than 20 operations on the right femur. I want to ask why. And this is a picture on the admission time. Surgeons applied this frame 1.5 years ago. During this time, patients not walk, very little, only necessary. Of course, use crutches, and 1.5 years she spent in the bed. And during all of this time, she not put weight on the right leg. The range of motion of her knee joints, very small, no more than 10 degrees. And what do you think? What is it? Because my opinions, this is not osteosynthesis according to Ilizarov. This is admission picture, but we need little bit layer. We'll need to know about story of this case. Beginning of history. This story could have happened in any country, but I think not in any doctor. Diagnosis and admission for us. Tibia hemimelia, shortening of the right tibia. This is my diagnosis. And before treatment, many years ago, in another city, in another center of treatment, full flexion of knee joint, slight limitation of extension in the knee joint, and child walk a lot without additional mean of support. The lid on the leg is full, is the load, sorry. And this is first surgeries. And doctor write down Ilizarov osteosynthesis. For me, this is not according to Ilizarov. First operation was at age 9 years. I don't know what did this surgeon. What's happened? Maybe he correct here, but this is after remove of frame. All of picture give me patient. In our treatment, everything is important. And you see, this is right leg. Radiography should be correct. This is small things, but from small things come big point. And from little things add up the results. Again, this is right leg, but radiologist put this X-ray like left leg. Knee joint function after 1 year. Before this surgery, function was full. And still, radiography not correct. Time is go, baby is grow, incomplete flexion in knee joint, and same mistake with radiography. Then again, doctor write down osteosynthesis by Ilizarov. I need to write down not according to Ilizarov. And doctor did lengthening more than 6 centimeters femur. On the lower part, use only half pin, shunt pin. During this time, patient not use leg, not weight bearing, not move knee joint. Patient stay alone at home without any contact with doctor, only send radiography and continued, because doctor control only condition of regenerations and wait time for removal frame. 1 year fixation may be enough for remove. And during this time, girl did not use her leg. Range of motion, very small, 5-7 degrees, no more. And the child's leg was looking for and find the knee joint in another place. When anybody walk, we need flexible our legs. And fracture, femur fracture, accurate while walking, not fall down, not car accident, only walking. And this is not deformity. Legs find new knee joint. And another old mistakes, this is right leg. This is not left leg. But radiologist write down. Small things. This is not mistakes, but this picture invite problem. And that try correct this situation with plaster cast. Time with time goes, knee joint not work. And during this presentation, you can see we haven't any contact between radiologist and surgeon. All time, same mistakes with radiography. In other osteosynthesis, this is new osteosynthesis by Ilizarov. Write down that. I think this is not by Ilizarov. Only metal, only external fixator, doesn't move. In this stage, the child was treated by one of the creators of the Rajtv apparatus. Great surgeon. Again, lengthening, again, no function in the knee joint. After the end of lengthening and correction, the SUF apparatus was replaced with an external fixation device. Not work, knee joint not bent, and error does not go alone. An error creates an error. All the little things suddenly lead to big troubles. In other surgery, again head fracture while she walked. In other external fixator, for me, this is not Ilizarov frame. And I have one question: why surgeon not correct varus deformity? And you can see position of the knee joint. Many months fixations. You can see osteolysis near the half pin. Broken again. Doctor put plate. Please, I know won't comment that. Finally, the right picture. This is right leg. Please check situation on the knee joint. She not walking. And something has to happen. Again fracture. Again doctor put another osteosynthesis. Now, maybe not so bad of this picture, but next we can see the right X-ray image on the knee joint with maximum flexions and maximum extensions. For me, this is picture same. No function in the knee joint. From osteosynthesis, according to Ilizarov, there are only wires with ellipse here, but this wire should be here, because this is area of knee joint. And the time of admission, first time I contact with a girl with this picture. Many years of treatment. Once the operations of the knee joint, doctor open knee joint, try to do something with release of soft tissue, with tenderness, but this is memory from doctor. Not bad. And diagnosis from our clinic. Tibia hemimelia, shortening of the right tibia, condition after surgery, persistent combined contracture of the right knee joint, multi-component deformity of the right femur, torsion subluxations of the right tibia. And the tibia has never been operated on. This story could happen in any country, but why did this story happen? Let me show another case. I find another case from my mobile. Simple situation from beginning. Girl, 9 years old, got injured on a carousel, and then standard treatment. Close fracture on the left femur, low third with displacement of fragments. At admission, doctor put on plaster cast under general anesthesia, did reposition, but X-rays was not taken. Position in the fragment is unsatisfactory, and next day Duct reposition was carried out, fixation with Kirchner wires, and reposition of fragments was achieved. 1 month fixation with plaster cast. And this is my comments. Kirchner wires pass through the grow line, grow zone and grow line. After 1 month fuse distal osteoepivisualization of the femur, and with osteosynthesis according to Ilizarov, we could pass the Kirchner wires above and below the growth zone, and not through it, and not interfere with natural growth. Very quickly, Kirchner wire ductor remove. For another month, the girl used removable plaster splint. This is golden standard of treatment. Fracture is consolidated. Range of motion of knee joint was not so bad, near 30 degree. All the rules doctor are followed. The protocol is fulfilled. The result is good, but a few more months coming varus deformity. All is well of these X-rays, but all is not well on these X-rays. And doctor, very popular in the Russia, start treat with, how I can say, gold standard in the treatment of single component of the on the deformity, not on the Russia, on the world, all of the world. Doctor put on how our colleagues say, controlate osteosynthesis with 8-shaped plate for controlled correction of varus deformity. After operation, obligatory wearing on an orthopedics brace. I don't know how this osteosynthesis by used to control deformity correction. The girl is grow, and with her, the deformity grow. Time goes, deformity grows. All of this period, more than 3 years, permanent wear must use orthopedics brace. All of the day. Time is running. Another year of controlled correction passed. So many. Problem doesn't come alone. Problem calls problem. There was a shortening in the limb, not only varus deformity. Because my opinions, 8 plates still potential for growing. 3 years after synthesis, 3 years of orthopedic brace. And what is next? Young girl. 8-shaped plates, doctor remove, control, few years, support to the shoes, and with this picture, girl come in our center, in Ilizarov clinic in Kurgan, with limb length discrepancy more than 6 centimeters, varus deformity, and almost near 100 millimeters deviation of med from the center of knee joint. After walk, she very quickly tired and usually sit. Treatment according Ilizarov. And patient on the next day start walk. We start lengthening after 4 days. Each day physiotherapy, if each day contact with our physiotherapist. And on the end, we correct, but still we length more than 6 centimeters, but not equalizate, because function of knee joint was not so good. And this is girl very quickly grow, and we have plan finished of our treatment after few years. The period of consolidation, patient stayed at home. During 2.5 months, full consolidation. And also we have a problem. Very sorry. Because just now this picture cover small inflammation. This is only one problem during the treatment. And Ilizarov apparatus does not interfere with ordinary life. You can see on the left leg, girl with apparatus. Coming time for remove. And we remove of this frame. And this result I dedicate to him. On the mirror, you can see one man. This is physiotherapist. 10 days ago, same day with me, he has positive result of SARS, COVID. He back this girl to the normal life, because surgeon only one part of treatment. Without physiotherapist, we cannot get result, because only team can support our patient. A few days ago, this man died. But life goes on. And you can see a result not only in my hand. This is the result of physiotherapist. Happy girl and Ilizarov forever. Thank you very much, dear colleagues. And I hope time will come when we can meet and change our experience shoulder to shoulder, face to face. Thank you again. Be healthy.
Thank you very much, sir, for your excellent presentation. Now, I'd like to request Professor Mofakharul Barisar to say something regarding the presentation. Sir, you have to unmute yourself, sir.
Oh.
Yes, sir. Yes, sir. We can hear you, sir.
You can hear you now?
Yes, sir.
Okay.
Yeah, okay,
Fantastic,
sir. It's okay.
Fantastic. Fantastic. So this is the learning. The two cases that he has shown from his experience of life, you know, is a great learning for everyone, for all orthopedic surgeons. He has shown the first case, you see, simple tibial hemimelia with simple shortening. The surgeon who treated the case started doing, you know, his own treatment. He's addressing at the same time in the femur and in the tibia. As a result, what happens? Before coming to his place, she was operated 20 times. And sequentially, the problems arises, and he has solved all the problems in the Kurgan Center. This is the case one. So before doing any surgery on the first case, you must think yourself what is happening in the knee or in the femur, up lower end of the femur, upper tibia, and at the same time LLD, and how you can handle that case. This is the great learning for the case 1. And case 2, again, he has shown the girl of 9 years old how to handle that one. He was treated in different places with different implants, and at the same time, the consequence of using the 8 place and how to put the 8 place. And what happened? Again, the deformity. Again, you are doing surgery, but at the same time, you are inviting complications, range of motions in the knee, again is, disturbing the patient. So the second case, what he has shown, fantastic case, how to handle by single case, you can correct the deformity, you can go for the lengthening, and at the same time, you can use the range of motion in the knee. So thank you very much, Novika Professor, my dear friend. You have shown a very fantastic case. This is a learning for everyone. And I have learned the case from you, that what you have shown. Thank you very much again. And this is a very, 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 challenging case, how to handle these kind of cases. And I think from your lecture, the young budding orthopedic surgeons, they will be able to learn and how to tackle all these cases. Thank you so much again. Thank you.
Thank you very much, sir, for sharing your extraordinary knowledge with us. Now, I would like to request Dr. Shamsul Huda sir to say something regarding today's presentation.
Thank you, Dr. Tanvir. Thanks, Novika, sir, for such a wonderful legendary cases. And as rightly Badisa said, like the knee virus girl's case, it is a regular surgery complications that we face in our day-to-day surgeries. We regularly do this KVACs in our surgeries, and none of is spared getting these complications. Either we apply a plate or a wire, like something like that. So it is a wonderfully elaborated cases, how to handle. So the best apparatus ever is seen is Ilizarov, because it gives natural growth, no deformity. Thank you, sir.
Thank you very much, Dr. Shamsul sir. We all know that it is very easy to operate, but it is not very easy to overcome the difficulties. That means the challenges. If we can overcome the difficulties, then we will be a great surgeon. And thank you, Professor Novikov sir, to show us something special, something critical. Now, I would like to request Dr. Omar sir to say something. Dr. Omar sir from Kurdistan, Iraq. Sir, please.
Okay, thank you so much. Thank you. Do you hear?
Yes, sir,
Yeah,
we
yes,
can hear
yes.
you, sir. Sir, we can't hear you, sir. Maybe he is disconnected. Would you please connect him? That was a great presentation, sir. And I think young surgeons like us learned a lot of things from two of our legendary Ilizarov surgeon, and Professor Mafakharul Bari sir and Professor Novikov sir. And thank you very much, sir, for sharing your knowledge. In spite of your COVID positive, you are with us, and we all know that you were in quarantine or you were in isolation period. But during your isolation period, you are sharing your knowledge. That's a great thing, sir. That's a great thing, and it has no barrier. No COVID barrier is there.
Dr. Anwar, can I ask my colleagues about first case? Just now, she have infarction in knee joint. She have limb length discrepancy. What we can do next time? Which kind of surgery she need? Because just now she in my hand. Because I think simple lengthening of her tibia, not back to the function of knee joint. And what we can do for prevent of this situation. Because on the finally, she has small discrepancy, but For me, function more important than discrepancy. We can put support and continued life. Without function, this is another life. This is another level, very low level. And colleagues, what you can see, how we can solve this problem. Because just now she start life with big difficulties. What we can do for next patient with this situation?
Professor Mafakrul Barisar, please. Please unmute himself. Please unmute Professor Mafakrul Barisar.
How old she is now?
20.
20. Now, very easily, you can go for, if you want, you can do two types of operations, either Judev's quadricepsplasty or modified Judev's quadricepsplasty for increasing the range of movement in the knee. And later on, you can go for leg.
Already once she has.
What?
Doctor already open knee joint in St. Petersburg. Okay. Everything changed, but not take function.
No. What about the range of movement now?
Few degree, no more than 10 degree.
Even then, if not, you can put the Ilizarov first, go for a distraction. Go for a distraction.
On knee joint.
Of the knee joint, yes, 20 years. And then you can go for, if there is no deformity, then you can go for modified Judev's quadricepsplasty. Modified. Yes. I don't know what kind of operation he has done. Open everything, what kind of operation? Only lengthen?
No, something plastic surgery, something lengthening of tendons, something release of scars, nothing more. But already opens the knee joint.
So what? Again, you can try for modified Judev's quadricepsplasty. That is 3-step surgery you can do. You can go for from the lateral side. You know, from the lateral side, I can tell you how you can do that. You can just from the lateral border of the patella, you just open in that one, and in the lateral collateral ligament it release, and gradually it try to remove all the arthrofibrosis of the joint from the lateral side. And below the patella, you can clean everything, and you can go for patellar traction for 2 weeks, 10 to 2 weeks traction in the patella, putting the weight in the ankle. And you can see my publication of modified Judev's quadricepsplasty in Medcrave American Journal. 2 publications was Judev's quadriceps and modified. It is very simple. You can do that. You can try that. And you can see in the Medcrave Journal of American publication. Modified.
I will find another way. When she will admit next time, I will contact with you, Dr. Barry.
Okay, thank you so much.
Sorry.
Yeah.
Can you interfere? Yes, please.
Yeah. Yes, sir, please. Omar, sir, please.
Yes. Yes, please. Thank you. Thank you so much. Do you think that any sort of medication can help to prevent refracturing? For example, if you are sending for laboratory investigation. Yes, please. Do you listen?
Yeah.
Yes. If you are sending for laboratory investigation, probably zoledronic acid or vitamin D and calcium will help for the prevention of refracturing.
Dear colleagues, you see, she has excellent consolidation.
Yes.
Good fusion, but not function of knee joint.
Yes.
Any strong condition of bone not give protection of these complications, because legs find knee joint.
Yes.
Knee joint not work. Legs to do new knee joint, make fracture. For me, like that.
Okay, thank you so much.
If we have biomechanical problems, if we have contracture, problem will come. And my point, dear colleagues, when you start lengthening, what you want, centimeters You want equalized, or you won't get result with functional result. When patient can walk, when patient can bend, unbend knee joint. Why? On the end of treatment, second patient, we have discrepancy. Because during the treatment, function of our knee joint was like that. And Ilizarov says, if function of knee joint not enough, stop lengthening. Because centimeters equalized, this is not good result. Functional with lengthening, this is great result. And mother heard me. She won't equalized, full equalized, but only 2 centimeters. This is a small amount we can get. But if with second patient we continued our lengthening, we lost. For the all of the life, we lost excellent result for future. And during the treatment, must all time contact with patient. First patient, she all time stayed alone. She haven't any experience. She haven't any knowledge. She haven't any possibilities. She only listening at home. Second patient was in front of doctor when she was with Ilizarov frame. And we cannot go away from patient. This is a great magic situation. And just now I cannot say 8 plates, this is normal treatment, but this is not, this is out of hand of our surgeon. All of situation not in our hand. We cannot control correction deformity, and we cannot support, we cannot something do. During the treatment with Ilizarov frame, we can everything. This is our possibilities. This is our freedom. This is choice for patients get result. But this is magic music, and we need stay near with patient all period of treatment. This is my point. Thank you.
Okay, thank you so much. Thank you.
Thank you very much, sir, for sharing your knowledge. I think it's a great day for us, as because of we have learned many things from our legendary professors. And dear viewers, I would like to thank Rajtv for helping us to arrange this type of academic program, and definitely Renata Pharmaceuticals Bangladesh Limited for sponsoring our program. I'm Dr. Mohammed Tanvir Ashraf saying bye-bye today, and hope we will meet in the coming Friday with another magical Ilizarov topic. Till then, I would like to say bye-bye to all of you. Bye-bye.
Bye-bye. Thank you so much. Thank you. Goodbye. Goodbye.
You are watching Rajtv, Jagorone, Bangladesh. Please subscribe our channel.